Thank you all very much for coming. Again, we're going to have a show where people are basically going to talk about the things they've done.
Well, hi everybody. I'm Jonathan Fowler, the artistic director and designer for Richard Joseph Salon Spa. And we were lucky enough to be welcomed here to help out tonight. Had a lot of fun, did some pretty hair. But I just want to talk to you a little bit about upcoming trends, things we're seeing, fresh off the runways from New York to people in our own backyard here in Birmingham. So, seeing a lot of texture. Give up the ironing. It's not that necessary anymore, people. Back off a little bit. A lot of volumes coming in, a lot of texture, just anything interesting. Nobody's doing the curtains anymore. It's very harsh. We're looking to really look our best and be soft and pretty. So anything you can do to stand out a little bit, whether it's a little bit of an accessory, anything fun, just have fun with it. It is your best accessory. So that's it for me.
Hi, I'm Angela King, makeup artist at Richard Joseph Salon Spa, English Village. And I guess today for the fall trends, we're going to talk more about smoky eyes, which is always good for fall, and then glossy lips, or you could do like a matte red lip, which I always think is hot.
Brantley is next.
First, just tell you a little bit about Dysport. Everybody's familiar with Botox, so everybody knows how Botox works, kind of where you use it. But great thing about Dysport, it's been out forever in Europe, so it's really common over there, but it's kind of uncommon here. So when people think Dysport, they're like, oh, it's just kind of a knockoff of Botox. So that's not the case. It works the same mode of action, just the dosage is a little different. We're actually right now, through the end of this month, we're offering $150 off 2 treatments of Dysport. So the thing about it, if you come in, you get treated, you get $75 off your first treatment, and then we honor your second treatment to the end of January of next year. Great thing about your second treatment, for whatever reason, if you don't like your Botox or your Dysport and want to go back to your Botox, we'll give you another $75 just for that. So you really have nothing to lose to at least try it. So just so you know, so don't be scared, it's not a knockoff, the same makers of Restylane. So.
My Scoop is here, and this is their red carpet. Some of you might know about, and we're happy to have them here. The idea for this is really, I think that people try to hide that they've had surgery or that they've had something to do, and that's fine. There are a lot of people that want to hide it, but there are also a lot of people that want to talk about it. And for some reason, we all need permission to do things or to feel that things are okay. At some points in our lives, we really don't care. But it's good to hear other people and what they've done. And a lot of people think that, especially cosmetic surgery, because of all the television shows, has to be extreme, or it has to be some big makeover. We all think about the Swan or extreme makeover, and it really doesn't. And you'll see in some of these people, I mean, you can have something very small that can make a big difference in how you live your life every day. I don't know how many of y'all have been to alabamafairytale.com, which is one of my websites that has some of these people on it that are willing to share and talk about the things that they've had done. And the surgery is a part of it, but then there's all this other stuff that happens as far as inside of people, that it's just like a flower and it's tight and then it blooms. And to me, it's really, really fun and really rewarding to watch people, especially women, get their self-confidence back. Because we go through so much, bodies change, we lose control, we get married, we get divorced, we have children, whatever it is, everybody has their own stuff. Some of us take care of sick parents and feel old and stressed, and there are all kinds of ways to rejuvenate yourself and make yourself feel better. And this is just a way to show that and to have some fun, because at the end of the day, we all want to laugh and we all want to have fun. But surgery is serious, and we do take it seriously, and we've gone to great lengths to have our operating rooms accredited by AAAHC, which means that we meet all the requirements basically of a hospital. Dr. Kingsley's here from Alabama Vascular and Vein. I think he wanted to say a few words.
There have been a lot of advertisements on the radio about going to, you heard them, you've heard that if you want liposuction, smart lipo, you've got to go to the plastic surgeons. And so we looked into that a little bit and discovered some interesting things that I won't bore you with. But in brief, Dr. Petro may be the only non-plastic surgeon who is a cosmetic surgeon who is approved by the Alabama Medical Board to do cosmetic surgery. We do a huge vein business across the hall, and we have 4 operating rooms, 2 of which are upscaled some for her cosmetic work. We do general anesthesia. We hire a group of anesthesiologists I used to work with at Caraway. They're absolutely superb. They're best in Birmingham. And we self-imposed a review by this outfit in Chicago to be sure we are equal or better than almost anybody doing office-based surgery, and they gave us their maximum approval after their review. So you can take that to the bank if you choose to come here and have something done.
This is Kathy. Kathy came to me, not that she's not beautiful before, and she actually saw us in Tuscaloosa, and she had some spider veins, and she also wanted to talk about what she could do in 2 weeks for a reunion. So I told her we could fill her full of fillers, or we could actually, do the surgery, and she was probably, one of the most remarkable patients we've had. She was great through the whole surgery, was done, was just ready to go home, and I don't think she had a bruise. And
I didn't take a pain pill either. I didn't take a pain pill. I was excited, didn't think it would ever happen to me, and I'm ready for more things now.
Tell them about the reunion. What kind of comment?
I was going to a family reunion, 50th anniversary. I was the youngest one that was going to be there of all the relatives, and I felt like I looked like the oldest. So I said I need help because I felt like I looked sad, and I'm not a sad person. I'm a very happy person, but everything with gravity was just dropping. And I said, I want this done, and I want this done, and I want lips done. And she said, well, we can do it. And my husband says, well, okay. And I said, when? Because I've got to be ready in 2 weeks. And so she did magic and did it on Tuesday, and because I am from Tuscaloosa, I spent the night here in across from the Brookwood Village at one of the inns there, and came the next morning, felt great. She undid everything, sent me home, and that was it. And it's not been quite 3 months, and it's been fabulous, and everybody was shocked when they saw me. I felt great because I knew I was going to be there all week and do fashion stuff and swimsuits and all that, and I was just really dreading it, but it was great.
This is Connie.
So I just want to say it was a perfect perk, and I came to see Dr. Kingsley about having the varicose veins and all done in my leg, and he just was so loving and so sweet, and he just says, we just need to tweak you a little bit. So he brought Melanie back there, and it's just been like, I can't tell you, I've never regretted. I've been so happy I did it. And when I see her, I go, I love you, don't I?
This is Ray and Carol. Carol, you want to come with her? And they have, they actually wanted to have stuff on the same day. Carol had an accident and had some trauma to her lip, and so we took some fat and put some fat in her lips. We tried other things. Fat grafting works really, really well. You can basically take fat from anywhere. She was unique because she did not want any anesthesia, so she was awake and great and looked in the mirror and said, that's good, I'm happy, and walked right. It was really impressive. Ray did want some anesthesia. And did faint, scared me to death. But she said she just does that every time somebody sticks her, so that was just the IV. After that, we were good. Ray had her bust done, and she had some liposuction, and she looked great anyway, but we just tweaked a little area on the back of her leg so her pants would fit just a little bit better. Mike's one of my very favorites. He lets me do whatever I think. He brings me all kinds of people because he kind of self-diagnoses them, and he'll come in with them, the ones he likes, and say, can you do something about this? Because I've been dating and that bothers me. So we try to fix it. And he doesn't want to say a word, so I'm not, but he did bring me.
She wants me to take my shirt off.
I do.
This was me. She sucked out this.
You want to show him your scars as long as you're showing it all?
Here's a scar. Wow. And she got this.
And he did a commercial. Who was it in the cowboy hat? Kenny Chesney?
Yeah,
Who was it?
That was for Ed and Fred.
And you should see him in his cowboy hat with his neck. It's really hot. Doesn't he look fabulous? Would you like to do a walk?